it was a weird time to be campaigning. And you think about all the other questions leading up to this one, it's all about COVID-19. And that's the context in which we're running a campaign, which means you can't contact people the same way as you usually can. It also means that when people's lives are really disrupted, a message of let's make a big change it's a harder message to sell. So I'm proud of the campaign we ran. I'm proud of the ideas we ran on, the incredible slate of candidates we put forward. I was hoping for more seats, but that's not what people were ready for this time. The good thing is we now have a caucus of 13 strong MLAs. We're in a situation where as a party we're not doing what we had to do the last several elections, 3 elections, have a leadership race right after and go through all that internal work. We now get to focus really on building on what we've got, and I'm excited for what we're going to be able to do over the next 4 years and what we'll see in 2024. Is there work to do on how we communicate that, on how we reach out to people, on the partnerships we build between now and the next election? Absolutely. And so we're going through some work right now, asking ourselves the tough questions, reviewing the election, and then making a plan for over the next 4 years, where instead of being where we were, even in this last election, only a couple of years into a new leader, still kind of learning on the job, building on the foundation we have so that 4 years from now, we know we're going to be able to be in a place where we can speak to what's exactly on people's minds and see some real change. It's been really upsetting, and it's been upsetting to watch knowing that this was preventable, right? We saw this coming, and we had all summer and all fall to prepare for it, and instead this government didn't take the time to do the work and didn't take the early actions that could have prevented what we're dealing with today. And we talked early on in November about a circuit breaker, getting quickly some restrictions in place to bring down the viral load. So come Christmas, businesses could be open, people could be seeing their families. Fortunately, we missed that opportunity. So we got the worst of both worlds. We've got businesses being told to stay open while their customers are told to stay home. We've got people missing out on Christmas, but we still have hospitals increasingly full of patients who are COVID positive. And that means we didn't get it right. It's the wrong balance. Early on in the pandemic, I got my license again and started working at the testing site and started doing regular clinics at the Lighthouse. I've kept doing the Lighthouse clinics, and just this last week, I went in for what they're calling upskilling. So anybody who hasn't worked in hospital regularly is being invited and recruited to come and do a little extra training, get up to date on how to work with COVID patients in the hospital in particular. So I just finished that training. I'm hopeful that if things go well over Christmas and New Year's, the parties aren't too wild and people don't wind up seeing a big increase in the number of cases, that I won't have to be called in, but I'm ready to go and work if there's a field hospital or whatever it is that's needed. And I know that my colleagues in medicine and nursing and all the health professions are doing the same thing and are ready to step up. I just really hope that we don't get to where that's needed. This is so exciting. I mean, what an amazing time to see a vaccine developed less than a year after a new disease emerged, a new disease that spread around the world and had such a huge impact. And there's hopefully an end in sight. We don't know everything. Will COVID change? Will it be an annual thing like a flu where there's something new each year? Will the virus or will the vaccine do everything we need to prevent transmission? We don't know all of that, but we know that it's going to be way, way better than our current circumstance. So I'm excited. I'm excited to see that vaccine rolled out. It's great to see healthcare workers. I want to see vulnerable seniors getting vaccinated right away. People are immune compromised, and then the whole public. I also want to make sure that we don't get ahead of ourselves and relax before we can. That we don't ease off because we see the finish line ahead. The vaccine won't bring anybody back who we lose in these next couple of months. So let's stay vigilant, stay on top of it, but also recognize that there's something to be hopeful. We're not going to be in this mess forever. I was actually thinking that it was a lot more like years past in some ways. I grew up on the farm by Curvahal, southwest of Moose Jaw. And when you're on the farm, that's Christmas. It was me and my folks and my brothers. And so it's going to be a little like that. It's going to be like a farm Christmas, me, Meili, and our 2 boys, and we're going to make the most of it. We know that we're missing out on things. We don't get to go visit Meili's family out in Quebec, or my folks in Moose Jaw, and there's all the friends that come back around usually that are living away, come back at Christmas time that we'll miss seeing. That stinks. But we're gonna make the most of it and really focus on our 2 little boys. They're 3 and 9. I want them to remember this Christmas as a really special one.